o'clock, and we have Dr. Kieran Moore with us. Dr. Moore is a very busy person these days, as you all know. You and I had a conversation about a year ago when this was all beginning, and you, using a very Canadian analogy, said, Mark, this is like a hockey game and we're in the beginning of the first period. My first question to you, Dr. Moore, where are we now? What period are we in? Is this the same game? Use the hockey analogy to help us understand what's going on.
I first just want to say thanks very much for the opportunity to speak to this audience and with you, and thank you for all your service to our community. You're right. I thought we were heading into the third period, and that our immunization strategy would help and get us through this. But we've been throwing a curveball in the game. But the game has changed. The team has changed. That is our adversary. And the game's going to go on longer than I expected. And sadly, we're seeing that across Ontario, that the case counts have gone up. It's mainly being driven by the variant called B.1.1.7. So variants basically are the changes that naturally occur to the viruses over time. There's small mutations that occur. So we've done a really good job, and I have to celebrate the vaccination strategy we've had for our long-term care facilities and for our high-risk retirement homes. And in KFLA, so proud of our community, we've achieved 95% of those over 80 have had their first dose, at least their first dose. So across Canada, and through the recommendations of the National Advisory Committee on Immunization, we want to get as many first doses in as many Ontarians and Canadians as possible. That builds the population immunity. And once we've done that, we're going to go back to second doses. But the best means of protecting everybody, which protects you as an individual, but as a community as well, is first doses. AstraZeneca, J&J, Moderna, Pfizer, all have shown the same benefit of stopping you from needing to be in hospital and or buried as a result of this COVID virus. And that's the most important statistic. Yes, there's a very, very rare association with this clotting issue. We don't know the exact numbers. It might be 1 in 250,000 to 1 in a million chance of that occurring. For context, that risk, women during pregnancy have a 1 in 300 chance of having clotting, having a clot in their calf. Birth control pill has around a 1 in 1,600 chance of you developing a birth control pill. And in general, in the community, we have a 1 in 3,300 risk of developing a clot at any given time for medical conditions. So the 1 in 250,000 chance is relatively small. And COVID itself makes you develop clots in a small fraction of people, much higher than that 1 in 250,000. Or we were an early implementer of that, and I think, my goodness, we had 0 deaths in our long-term care facilities, retirement homes, and I'm so proud of them. They've got a tremendous track record, and just so you know, I further sort of created an impetus so that they achieve 90% vaccination of their patients, 90% vaccination of their workers, and 90% vaccination of their essential caregivers. And we have at least 4 that achieved 90, 90, 90. Now, I mean, it's such a good question and such an important point. It's been a long and difficult year for everyone's mental, physical, and social well-being. We cannot vaccinate ourselves out of this. And you can get asymptomatic testing. We're one of the few jurisdictions that allows asymptomatic testing at Beach Grove and at Lennox and Addington Community General Hospital.
That's really good to know. And you talked about getting that asymptomatic testing at Beach Grove, and I think you said a couple other locations. Can you just show up there, or do you have to make an appointment?
No, you have to book online. So that's Beach Grove Assessment Center, and that's Googleable. And then Lennox and Addington, so Napanee Hospital, LACGH.
Okay. Somebody said, Carol actually asked if you're looking for volunteers to help do contact tracing. Are you looking for that? Are you still looking for that? If so, how
what a great question. It's Volunteer Week, and we were celebrating our volunteers. We had 150 volunteers help us, and we couldn't have done it without those that are helping our immunization centers and our contact management. So if you're interested, you can always contact through our main phone line, so 549-1232.
Dr. Moore, one last question for you. When people are vaccinated, if they go and they get a vaccine in their arm, are they now free to go and do whatever they want?
Please don't change your behaviors.
I know I speak on behalf of everybody here, and indeed the vast majority of people in our health unit, when I say that we are so incredibly proud of the work that you and the team have done to get us through this. Honestly, when I go and I get into Zoom meetings with colleagues from across the country, there's a sense of pride that I have, because I know that people look at Kingston and think they're doing it right there, and it just makes me feel incredible. So we all get to relish in your success, because you've given us that opportunity, and we're so grateful.
Well, I think it's a community. I'm so proud of the community. We have done well together, and we will continue to do well. And very proud of everyone in KFL&A.
Thanks, everybody. Have a great day. Thanks, Dr. Moore.